From Lagos, the nation's commercial capital, this is the News at 10. Live from Channels Television. Reporting tonight, Ijoma Unyato.
Hello and welcome. Total COVID-19 cases in Nigeria rise to 276 as NCDC confirms 22 new patients in 5 states. Federal government says more of the recent infections in the country are community-based. 15-member Chinese medical team arrives in Nigeria to assist the nation's efforts to contain the COVID-19 pandemic. Police arrest over 70 people in Lagos as many residents in the nation's commercial center continue to defy the order and restriction of movement. And COVID-19 pandemic wreaks more havoc across the world. Death toll in Spain rises above 14,000, while confirmed cases in the United States nears 400,000. Plus, business, sports, news from Abuja, the FCT, and later on international news from our London studios.
On business news tonight, African Development Bank Group unveils $10 billion response facility to assist regional member countries in the fight against the coronavirus pandemic.
On sports news tonight, the Nigerian Football Federation receives ad hoc committee's report on Football League reforms, promises to implement the recommendations.
And from Abuja, National Assembly leadership calls for equitable distribution of interventions to cushion the impact of COVID-19 on Nigerians as it meets with the Minister of Finance and Governor of the Central Bank.
The total number of COVID-19 cases in the country has risen to 276 after the Nigeria Center for Disease Control announced 22 new cases today. Of the new cases, 15 are in Lagos, 4 in the Federal Capital Territory, 2 in Bauchi, and 1 in Edo. A breakdown of the cases in each of the states shows that Lagos now has 145 cases, the FCT Abuja 54, Osun with 20, Edo State has 12 cases, Oyo 11 cases, Bauchi has 8 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State, while Enugu, Ekiti, Kwara and Rivers have 2 cases, with Ondo, Benue, Katsina and Delta states recording 1 case each. 44 cases have been discharged and 6 deaths have been recorded. Now, the Presidential Task Force on COVID-19 says it will publish full details of donations to the nation's relief account and how it's used. The Secretary to the Government of the Federation, Mr. Boss Mustafa, who is also the chairman of the task force, made the pledge at a news conference in Abuja. Mr. Mustafa explains that an arrangement is in place with the Office of the Accountant General of the Federation to make the account public.
We'll take 1 to 10.
It's the 8th edition of this news conference by the Presidential Task Force on COVID-19, and members are updating Nigerians on the federal government's effort to manage the coronavirus pandemic.
Have been recommended by
the task force explains plans to expand the infrastructure for treatment and testing as community links to more cases is on the increase.
I would like to ask all healthcare institutions, both public and private, to please look out for patients presenting with unusual respiratory tract infections, especially severe respiratory tract infections that cannot be explained, because this is an important indicator now for testing for coronavirus infection. More and more of our cases are now community linked. We are having fewer and fewer cases that are linked to travel abroad or contact with people who have been abroad.
Health facilities, both public and private, are called upon not to reject patients without giving them advisory on what to do, but to follow NCDC guidelines and refer suspect cases to COVID-19 test sites.
The task force is also holding discussions on how to return Nigerians in diaspora who are interested in returning to the country and promise to ensure accountability in the management of funds donated to fight the pandemic.
That the Presidential Task Force, working in collaboration with the Accountant General of the Federation, have concluded and published details of accounts into which donations by well-meaning members of the society and corporate organizations can be channeled. I must emphasize that transparency and accountability shall remain the hallmark of all transactions under COVID-19 activities. The expansions of the infrastructure for treatment is important. However, private hospitals that have capacity to manage COVID-19 cases shall seek certification by the Committee of Infectious Disease Experts assembled by the Federal Ministry of Health for standardization and safety of frontline staff and other patients.
We have sufficient beds and so forth, and the protocol is now well established. We now feel in a much stronger and better position to undertake this Herculean task of trying to see how we can bring Nigerians outside the country back into the country. And in that context, we've now started to get greater numbers of Nigerians, especially in the United States, where almost 200 have now indicated willingness to return. We're engaging with our embassies in China and our High Commission in London and also in France.
The task force explains that over 8,000 health workers from the public and private health facilities have been training on the treatment and management of infectious diseases.
Meanwhile, a 15-member medical team from China has arrived the country to assist Nigeria's efforts at containing the COVID-19 pandemic. Members of the team were received by the Minister of Health, Dr. Osagie Ehanire, after they arrived at the Nnamdi Azikiwe International Airport in Abuja. The Chinese ambassador to Nigeria, Dr. Zhu Pingjiang, told journalists that the medical team comprises experts in infectious diseases, respiratory illnesses, cardiology and intensive care. According to the Minister of Health, members of the team will be quarantined for 14 days before they are allowed to bring their expertise to bear.
Just last week, the Minister of Health, Dr. Osagie Ehanire, announced plans by the federal government to receive a medical team from China to help contain the spread of COVID-19 pandemic. This news was, however, received with mixed reactions from Nigerians, with some rejecting the plan. But the team is here. The 15-man team arrives in Nnamdi Azikiwe International Airport and was received by the Minister of Health. The Chinese ambassador to Nigeria explains the reasons for their visit.
At the most difficult stage of China's fighting against COVID-19, we received support of all means from Nigeria. It's time for us to reciprocate the friendship and kindness.
After a brief chat with members of the medical team, the Minister of Health thanks the team for lending a hand in containing the COVID-19 pandemic, but however states that they will be isolated for 14 days.
They will be in quarantine for 14 days. They knew that before they came, and they have undergone tests before they left their country. Nevertheless, they will be in quarantine for 14 days. Nigeria NCDC has gone to see where they are supposed to be in quarantine and will continue to pay. They are free to pay visits there throughout the 14 days. So that one is taken care of. But the equipment that has come today, we are very happy to see. The second consignment from China after the Jackma consignment. So we believe it will help us a lot in addressing the gaps that we will have had in commodities and also very important equipment. When you ask how many ventilators you have, we have 50 ventilators more.
Members of the medical team consist of experts in infectious diseases, respiratory illness, intensive care, cardiology and neurology. Part of the equipment the federal government received from the Chinese government includes test kits, ventilators, disinfection machine, disposable medical mask, drugs, and infrared thermometer.
Elsewhere, medical personnel are also vulnerable as the death of medical doctor from COVID-19 in Daura, Katsina State has resulted in at least 35 persons being quarantined after coming into contact with the victim. Governor Aminu Mazari announced this in Katsina, the state capital, while briefing journalists on the ongoing surveillance to prevent further spread of the virus. The governor said blood samples of the 35 suspected cases have been taken to the Nigeria Center for Disease Control Testing Laboratory in Abuja. He also noted that the state's Emergency Response Committee on COVID-19 has discovered that Dr. Aliyu Yakubu had received patients in his private clinic days before his death. He said a medical team was tracing the patient's register at the clinic to identify more suspects and isolate them. And for violating the lockdown and the social distancing directives of the Lagos State government, 78 persons have been arrested by the police. 51 of them were sentenced to 1-month community service by a magistrate's court following their arrest for exercising and working out in a group larger than 20 persons on the Gbagada-Oronshoki Expressway. Our correspondent Daredo reports.
The defiance against the lockdown order is growing by the day, as the activities on the streets suggest. The signature yellow buses are returning to the roads, while the usual Lagos energy creeps in. More and more people on the roads, some for work and many others for a walkout. An early morning drill by this group amid debates on whether it violates the stay-at-home order.
We really want to stay at home and add weight and add flesh, add fat, and also we need to keep fit. I get the point about the social distancing, but one thing for sure is that we are keeping at least 1 meter distance between ourselves. We are keeping 1 meter distance. And of course, we are sweating, we are getting back home, we are refreshing. So we need not to worry about that.
Coming out to do exercise in the morning or evening, to me, is the best. But I still advise Nigerians to social distance. Just give a space.
The outdoor fit fan population is growing in numbers and spreading to more locations in the past few days, with men, women, and even children joining the workout routines. Ifeanyi, an IT specialist, has brought his whole family out. He says it is better than staying indoors.
You have to be cautious of your activities. There's no point socializing, going into big events or going into crowded places. But then there's also the need for you to check your body. So locking yourself indoors all through, it's equally not ideal.
In line, I want you in line, I want you in line.
In Alakpa area of Lagos, this police formation is built to drive people back home. But in many other places, the fitness game continues.
The lockdown in Lagos, Abuja, and some other places in the country appears to have unlocked a new trend where fitness lovers are coming out, they're gathering in large numbers. They say the exercise is not only good for the body, it is also good for the mind. But as these people gather, the issue of social distancing still remains a concern as the country continues to fight against COVID-19. Daredo, Channels Television News.
In part 2, after the break, we examine the impact of COVID-19 on the aviation sector as we begin to count the losses from the pandemic in various aspects of our national life. But in a moment, please join us again.